Hi, welcome to CARE Samvaad with me, Mirchi Hemant, and today we have something really special, and that's a campaign. It's called the Healthy Joints Campaign. Din guరించి మాట్లాడడానికి I have the OGs with regards to joints. I should say Amit, Dr. Amit, Dr. Deepti garu, and alage Dr. Sharath. Sir, first thing, Sharath garu, మీరే స్టార్ట్ చేయాలి because I know we spoke last time over an interview, over a podcast, and you told us so many cool things. But ఇప్పుడు please tell me, ఈ Healthy Joints campaign ఏంటి and why is it best for the community?
So Healthy Joints, the campaign, what we are starting is involving all the departments. Like everybody is involving, and we want to give a comprehensive treatment to the patients regarding the joints. So how to take care of the joints, any problems, how to deal with them. So not every patient needs surgery, or not every patient needs a procedure kind of thing. So to guide them in a good way to maintain their healthy, joints.
Dr. Deepti, I've sat over here doing so many podcasts, and prati podcast lo final ga it filters down to saying having a good lifestyle is the answer for most of the problems, right? So with regards to joint health, me prakaranga, what are the lifestyle habits that one should have, or one should start incurring in their lifestyle in the larger population for better joint health?
So firstly, Andy, two things. A good diet and a good lifestyle, which includes a lot of exercise, is irreplaceable. You can't really replace that with any medication or any other procedures. So diet kochesi, you have to have a healthy diet, which is supposed to be seasonal, fresh and local. Avoid processed food, processed meats and a lot of junk food. And each generation, we're also seeing a lot of younger patients having earlier onset arthritis, inflammatory arthritis, gout, which are all lifestyle associated. Also sedentary lifestyle, ఇప్పుడు అందరికీ 9 to 5 జాబ్, sedentary lifestyle ఉండడం వల్ల ఎవరికి జాయింట్ మొబిలిటీ లేదు. దానివల్ల కూడా we are seeing a lot of joint pains and lot of joint issues. So we always have to eat healthy and move a lot.
Right. Dr. Amit, when it comes to joint problems or joint health, early screenings or early diagnosis, how important are they? I mean, in terms of the larger scale where you can early diagnose and you can fix it early. How do you say that?
Right. So early diagnosis and early management is most important step in any health condition. Right. It becomes more and more important in current times, even for your ergonomics or joint conditions, because now our habits are changing. We are adopting Western lifestyle, Western food habits, more sitting posture. We don't care about our body's ergonomics or positions. Earlier we used to play a lot as kids. We used to go around cycling and all. Nowadays that is all changed completely. Our kids are not doing that much. That is changed completely. So now what is important is hearing your body, listening to your body, where it always gives you signals something is not right. So there will be small pains, small twists, small issues coming up, and we keep ignoring, we keep taking some medicine, painkillers and forget. But if it is repetitive, you need to consult a doctor, orthopedic surgeon or anyone else, so that you at least get to know what is going on. And then preserve the joint. What action we take today is going to impact our life in future.
Correct.
Early action, preserving joints is most important part. What you do today in your 30s, 40s will determine how you live your 60s and 70s.
Correct.
So that's most important, that taking your body's signals very seriously and following the rules of ergonomics, following your lifestyle, following your posture in a right manner. You have to honor body's own physics.
Right. And also, I mean, now that we are talking about the Healthy Joints campaign, Dr. Deepti garu, rheumatology విషయానికి వస్తే మాత్రం రుమటాయిడ్ ఆర్థరైటిస్ కానీ లూపస్ కానీ ఇలాంటివి ఈ ఇన్ఫ్లమేటరీ జాయింట్ డిసీజెస్ ఏవైతే ఉంటాయో, వాట్ ఆర్ ద మోస్ట్ కామన్ వన్స్ ఇన్ దట్?
So most commonly, Andy, rheumatoid arthritis is still the most common. Danto patu, in younger individuals, we see ankylosing spondylitis, which is mostly back pain, psoriatic arthritis, which comes along with psoriasis. Lifestyle valla gout cases kuda chala ayyayi, which is basically high uric acid. And younger women lo we also see lupus, Sjogren's, chala rakalu unnayi. Also because lifestyle chala maradam valla obesity is on the rise.
Right.
Obesity rise avadam valla we are also seeing a lot of joint instability, joint related issues, low vitamin D, much more than the earlier generation had.
Oh, yeah.
So it's not just inflammatory arthritis, we are seeing a lot of other conditions which are related to the lifestyle.
Related to the lifestyle is the key word there. Sharath garu, what is most common orthopedic conditions that are affecting joints today, sir?
Most commonly ante ganaka osteoarthritis is one thing, that is the age related degeneration. So next comes is inflammatory arthritis, rheumatoid arthritis kani, ankylosing spondylitis kani, psoriatic arthritis kani, juvenile arthritis anedi untundi. So adi next is sports injuries related problems to the joints, most commonly for knee joints and shoulder joints. So sports injuries lo any ligament injury, if it is not properly addressed or not treated properly, that may lead to a joint issue in future.
Right.
So next common thing is road traffic accidents. Any injury, any fracture in the joint, that may give arthritis at a later stage. So if it is not treated properly, so all these things, these are the most common issues happening to the joints.
All right. Okay. And Dr. Amit, with regards to the radiation medicine, sir, what is LDRT treatment for joints, sir?
So basically, this is a new treatment that we have launched at CARE hospitals. It's called low dose radiotherapy. Radiotherapy, the word that comes, people think that it is related to cancer. But radiation medicine as such is a specialty where we use radiation or X-rays primarily for treating a lot of non-cancer conditions also. So it's like very low dose, 30th fraction of the cancer treatment that we do is given for low dose radiotherapy, and the mechanism of action is completely different. So what we are trying to do here is we want to block the chronic inflammation. Our body's immune system is overactive in those joints or areas like osteoarthritis, early stages of osteoarthritis, or plantar fasciitis like foot pain. The moment we cross 40 years of age, all these pains start appearing. Shoulder pain, frozen shoulder, tennis elbow, golfer's elbow, lot of plantar fasciitis or back pain or foot pain. So these are all chronic inflammations. Body's immune system is hyperactive in those areas, and most of the times they resolve within 3 months with medications, with other activity, physiotherapy, exercises and all. But sometimes that inflammation does not stop. That's where this radiation or X-ray therapy basically, given in low doses, very low doses, it just blocks that inflammatory process in that area, joint. The moment that you break that cycle of inflammation, automatically the body's own immune system stops becoming very active in that spot, where it was causing more harm than any benefit. And then the moment that cycle of inflammation is blocked, there is pain relief, swelling is gone, joint becomes freer, better. Especially this is more relevant in earlier or medium stages of the degenerative states or osteoarthritis and all, where we unfortunately don't have very durable options. Like you can replace a joint only when it's like grade 4 damage and all. But a lot of patients during that phase, grade 2, grade 3 damage, they continue to suffer with pain. There's no durable pain relief. They try physiotherapy. Majority of them may still benefit, but some of them still continue to have that pain. So that's where LD radiotherapy or low dose radiotherapy, it immediately helps them in terms of pain relief and making their joint more free, allowing them to be freely mobile. That's where the real benefit is. It's a very effective treatment, quite safe treatment. There's no fear, painless completely, no surgery, just walk in, walk out, like that.
Definitely painless is the key word there, sir. Deepti garu, autoimmune conditions antaru. How are they affecting the joints health? I mean, can they be reversed or only managed,
So, like Dr. Amit sir said, chronic inflammation is what leads to these rheumatological conditions. So it is your own immune system which is attacking your joints, and this is because of some immune aberrations. So these conditions can only be controlled, they cannot be cured, and the joint damage which occurs once cannot be reversed, the joint damage which already occurs.
Right.
So we can prevent the ongoing damage and we can prevent further joint instability.
Right.
So that's why earlier and prompt treatment is required in such cases. Because once we lose the joint stability, it is not always very efficient to get it back, and those cases usually go on to have surgery.
Oh, and again, when it comes to orthopedic surgery, sir, joint degeneration అనేది జరగకుండా ఈ మధ్యకాలంలో ఎలాంటి అడ్వాన్స్మెంట్స్ వచ్చాయంటారు?
అడ్వాన్స్మెంట్స్ అనేవి మనకి అంటే ఏదైనా కన్జర్వేటివ్ లైన్ ఆఫ్ మేనేజ్మెంట్లో చూస్తే కనుక దెర్ ఆర్ సమ్ ఇంజెక్టబుల్స్ వాట్ వీఆర్ రెగ్యులర్లీ హియరింగ్ పిఆర్పి థెరపీ అని, హైలోనిక్ యాసిడ్ ఇంజెక్షన్స్ అని, అండ్ ఫిజియోథెరపీ, అవాయిడింగ్ సమ్ కైండ్ ఆఫ్ యాక్టివిటీస్ లైక్ కింద కూర్చోవడము, మెట్లకి దిగడం తగ్గించడము, రెగ్యులర్ ఎక్సర్సైజెస్. సో దీస్ ఆర్ దేర్ ఫర్ క్వైట్ సమ్ టైమ్. సో ఇప్పుడు ఈ లో డోస్ రేడియోథెరపీ అనేది ఇట్ హ్యాస్ కమ్ అప్. సో ఇవి మనకి బేసికల్గా ఈ కన్జర్వేటివ్గా మేనేజ్ చేయడానికి ఉన్న మేజర్ ఆప్షన్స్ అనమాట. ఇన్ ఫ్యూ పేషెంట్స్ వీ అడ్వైజ్ ఆర్థోస్కోపీ ప్రొసీజర్స్. ఏదైతే డీజనరేషన్ ఏదైతే ఇంటర్నల్గా ఉందో దాన్ని మనం డెబ్రైడ్ చేస్తాం, అంటే క్లీన్ చేస్తాం జాయింట్ అంతా. సో వాళ్ళకి ఏంటంటే ఈ జాయింట్ రీప్లేస్మెంట్కి వెళ్ళడానికి ఇంకో 2-3 years ఆఫ్ టైం అనేది ఉండడానికి అవకాశం ఉంటుంది అనమాట. ఆర్థోస్కోపీ ఈజ్ కీ హోల్ సర్జరీ. దాని త్రూ మనం ఈ డెబ్రైడ్మెంట్ అంతా చేసినప్పుడు ఇట్ గివ్స్ దెమ్ సమ్ టైం.
కమింగ్ బ్యాక్ టు డాక్టర్ దీప్తి గారు, ఈ ఇమ్యూనోథెరపీ అంటారు కదండి. ఓకే, ఈ డిజీజ్ ప్రోగ్రెషన్ ఏదైతే ఆటో ఇమ్యూన్ జాయింట్ డిసార్డర్స్ మనం చూస్తుంటామో అందులో ఇమ్యూనోథెరపీ ఎఫెక్ట్ ఎంత ఉంటుందంటారు?
Immunotherapy, as in you mean the medications? Or,
Yes. Yes.
Yes, the medications are an absolute must. Endukante basically any inflammatory arthritis is because of unchecked inflammation,
Right.
which is because of cell immunity aberrations.
Right.
So if this goes unchecked, you have chronic inflammation. What chronic inflammation does to the joints? Joints lo meeku 3 parts untai: joint, bone, inka synovium. Synovium ante basically the lining of the joint. Rheumatology lo that synovium gets affected. So when you have chronic unchecked synovium, that disease synovium eats up into your cartilage, which causes joint instability, and it also eats up into your joint, into your bone, which causes bone loss. So if we leave the joint inflammation unchecked, like how Sharath sir had mentioned before, these patients have an earlier onset of degenerative arthritis, ante bone on bone formation avutundi. So if patients are not appropriately and promptly treated, they end up with joint replacements at a much earlier stage.
Okay.
And also much of joint deformities, and not all joints can be replaced.
Right.
So immunotherapy in these patients is a must. It is not optional, it is a must.
Okay.
And early and prompt therapy is a must.
Oh, got it. కమింగ్ బ్యాక్ టు డాక్టర్ శరత్, ఇందాక మనం రీప్లేస్మెంట్ గురించి మాట్లాడుకున్నాం. ఈ మధ్యకాలంలో స్పెషల్లీ మనం కేర్ హాస్పిటల్స్లో రోబోటిక్ రీప్లేస్మెంట్స్ అనేది హౌ హెల్ప్ అదే ఫర్ ద పేషెంట్స్ అండి?
Robotics, robo will help us to do the joint replacement. ఏ జాయింట్ మనకి ఇప్పుడు నీ రీప్లేస్మెంట్కి వచ్చినప్పుడు అలైన్మెంట్, స్టెబిలిటీ ఈజ్ వెరీ వెరీ ఇంపార్టెంట్. అది ఎక్కువ రోజులు రావడానికి, మనం చేసిన రీప్లేస్మెంట్ ఎక్కువ రోజులు రావడానికి. సో రోబోతో ఏంటంటే మనకు అవన్నీ మనం వాల్యూస్ వీ కెన్ అడ్జస్ట్, వీ కెన్ సీ ఆన్ స్క్రీన్. సో ఎలా ఉంది జాయింట్ స్టెబిలిటీ అనేది మనం చూసి చేస్తాం కాబట్టి లాంజివిటీ అనేది ఎక్కువగా ఉంటుంది. మనం చేసిన సర్జరీ ఎక్కువ సంవత్సరాలు రావడానికి ఉంటుంది. అందుకొరకే యంగర్ ఏజ్ బిలో 60 ఎవరికైనా కానీ జాయింట్ రీప్లేస్మెంట్ అవసరం పడుతుందంటే కనుక బెటర్ టు గో ఫర్ అ రోబోటిక్ నీ రీప్లేస్మెంట్ సర్జరీ. సో అదర్ అడ్వాంటేజెస్ సార్, సాఫ్ట్ టిష్యూ రిలీజ్ తక్కువగా ఉండడం వల్ల పెయిన్ తక్కువగా ఉంటుంది, రికవరీ ఫాస్ట్గా ఉంటుంది. నార్మల్ నీ రీప్లేస్మెంట్ కన్నా రోబోటిక్ ద్వారా చేస్తే ఏంటంటే హాస్పిటలైజేషన్ కూడా చాలా తక్కువగా ఉంటుంది.
సార్, with regards to radiation, say in complex joint cases, how does the collaboration between you and rheumatology and orthopedics, how does that collaboration happen in fixing a problem?
So I'll tell you one patient's case.
Yes, please.
We were dealing with one patient who was suffering from pain since almost more than 1.5 to 2 years. The lady was in her 50s. She could not move around. Knee joint pain, osteoarthritis had happened. There was a lot of edema, swelling. They tried physiotherapy, lot of medicines. Now you cannot take painkillers also for too long. My friend who was orthopedic surgeon, he was trying to treat her over time. Then when we started this treatment, and I informed him about this treatment, he said, okay, let's try this patient. Now those patients like her, she had a grade 2, grade 3 damage in her knees. That was not big enough to be operated upon for a replacement. And not the other treatments were not working. They tried some joint injections also. Joint injections work for say 1 month or 2 months, sometimes slightly longer, but the pain reappears, the problem reappears. So then they came to me and we gave a simple 2-week treatment course. And by the time she was completing treatment course, half of her pain was gone, and it's been now 9 months. And she's doing fine, much better mobility, she is walking around. So that's where when we know each other's strengths, what specialty works, that's what the idea of healthy joints is. Bring in multidisciplinary expertise, collaborate, work together so that we provide scientific evidence-based effective treatments that are beneficial to patients like that lady, and eventually the degenerative process will not stop. It will eventually progress, but the quality of life during that disease process has to be maintained.
Right.
And they need to be mobile. You cannot make them sit around. Then you have other problems. Weight gain will happen, heart problems will happen, they go into depression. That cannot be allowed. So when we work together, when we collaborate, then we find each other's strengths, and we use each other's understanding of that ailment, that condition, and what can be offered, what is scientifically better in that scenario, and we collaborate and offer that kind of treatment. And that's where the beauty of multidisciplinary effort is, where you collaborate, doctors collaborate from different specialty, bring in better life, better outcomes for our patients.
That is very, very important.
Maybe platforms like these will help create the. And Dr. Deepti, మీ ప్రకారంగా, what do you have to say about the Healthy Joints campaign?
See, first, Andy, not all joints can be replaced, and not all patients are the right candidates to replace. So I think this particular therapy that Sir was talking about can bridge the gap. Because most of the patients who come to me, they come with inflammatory arthritis like rheumatoid. Disease activity takku unna because of the long-term search cheppinattuga, because of the long-term joint damage, వాళ్ళకి ఆ joints లో pain వస్తూనే ఉంటుంది. So probably those patients at a younger age groups are not the right candidates for a replacement.
Right.
Or probably it would be in a joint which cannot be replaced, like probably a shoulder or an elbow, where replacements are not commonly done as
Right.
compared to hips and knees.
Right.
So probably the Healthy Joints campaign would help us determine who's the right patient for whom. And like Sir said, the patient education is probably the most important thing right now.
Oh, great. Anything that you want to say, sir?
Early treatment basically అంటే సిమ్టమ్స్ స్టార్ట్ అయిన తర్వాత సో 3 to 4 వీక్స్లో ఇఫ్ యు ఆర్ నాట్ రిలీవ్డ్ విత్ ద నార్మల్ మెడికేషన్స్, ఓవర్ ద కౌంటర్ మెడికేషన్స్తో చాలామంది ట్రై చేస్తూ ఉంటారు. అన్నిటితో అవ్వలేనప్పుడు ప్రాపర్ ఎవాల్యుయేషన్ ఆఫ్ 3 to 4 వీక్స్లో ఇంప్రూవ్మెంట్ లేదంటే కనుక కన్సల్టింగ్ ఎ డాక్టర్, గోయింగ్ ఇన్ ఎ ప్రాపర్ ఛానల్. సో రొమటాలజీలో మోస్ట్ కామన్గా నేను చూసేది ప్రాబ్లం ఏంటంటే పేషెంట్స్ రెగ్యులర్గా మెడిసిన్స్ వేసుకోవడానికి దే ఆర్ సిక్, అంటే వాళ్ళు అలసిపోతారు అనమాట. ఫస్ట్ అలోపతి, ఆయుర్వేదిక్, ఇట్లా అన్ని చెట్ల మందుల నుండి అన్నీ ట్రై చేస్తూ ఉంటారు. దే వోంట్ స్టిక్ టు వన్ స్పెసిఫిక్ దిస్ థింగ్. దట్ ఈస్ ద మేజర్ ఇష్యూ విత్ దిస్ రొమటాలజీ. ఎందుకంటే దట్ నీడ్స్ ఎ కంటిన్యూస్ ట్రీట్మెంట్ ప్రాసెస్. మధ్యలో ఆపేస్తే అగైన్ సిమ్టమ్స్ విల్ వర్సన్. ఓపిక అనేది ఉన్నది. అండర్స్టాండింగ్ ద ప్రాబ్లమ్ ఈజ్ వెరీ వెరీ ఇంపార్టెంట్. నేను మందులు తీసుకున్నా ఇంకా తగ్గట్లేదు అంటే ప్రాబ్లం అలాంటిది. దానికి డోస్ అడ్జస్ట్మెంట్స్ అవి చేసుకుని ఎలా నొప్పి తగ్గించుకోవాలనేది చూడాలి. కానీ మానేసి వేరే ట్రీట్మెంట్కి వెళ్ళిపోయి మళ్ళీ ఒక 2-3 నెలల తర్వాత మళ్ళీ వస్తే సో దట్ విల్ నాట్ ఇంప్రూవ్ దేర్ హెల్త్, ఇంకా వర్సన్ అవ్వడానికి ఛాన్స్ ఉంటుంది. సో ప్రాపర్గా ఎవాల్యుయేషన్ అండ్ ట్రీట్మెంట్లో కంటిన్యూటీ, అంటే ప్రాపర్గా మీరు జాగ్రత్తగా డాక్టర్ చెప్పింది ఫాలో అయితే కనుక డెఫినెట్గా హెల్ప్ అవుతుంది.
All right, great. Thank you so much, doctors. But before we leave, I have just want to ask you one question. If you weren't the doctor that you are, what's the alternative career choice, or what is the alternative, passion that you would have followed?
So, lot of things, but I keep thinking this question many times. A lot of doctors nowadays are thinking such questions. So, maybe I would have been better in some administrative or some that kind of roles.
Really, not guitarist or anything?
Sports I used to play. Badminton maybe would have been a good.
You would have replaced Pullala Gopichanda.
That's a huge shot to take.
Doctor?
I'd probably be a writer or a columnist. I
Wow.
love reading and writing, so probably more of that.
Maybe you can still do one day.
I hope so. Probably do some medical blogs or something, but I'd love writing.
All right, sir.
స్పోర్ట్స్, సో క్రికెటర్ కానీ ఆర్ వాలీబాల్. ఐ వాజ్ అ యూనివర్సిటీ ప్లేయర్ ఇన్ మై కాలేజ్. ఇంటర్ యూనివర్సిటీస్లో
మీరు ఎల్లుంటే ఇండియా ఒలింపిక్స్లో ఒక బ్రాంజన్ వచ్చేది.
లేదు అట్లీస్ట్ ఐపీఎల్ అని ఆడేవాడిని నేను.
He's a very good cricketer.
ఓ గ్రేట్. IPL, definitely IPL is missing you, sir. But thank you so much all of you. So healthy joints campaign అనేది ఈ ఆపర్చునిటీని చాలా మంది యూస్ చేసుకొని get your joints fixed as soon as possible. Thank you so much, doctor. Thank you so much. See you.